Let's now switch gears a bit to focus on Canada's armed forces. To help frame the discussion and provide some background on where we stand as part of our overall and our national policy right now, let's start with a recent assessment from our foreign minister in the context of our the current Russian invasion in Ukraine and what Canada could bring to the fight.
We all know that Canada is not a nuclear power, it is not a military power, we're a middle-sized power, and what we're good at is convening and making sure that diplomacy is happening, and meanwhile convincing other countries to do more.
So even if we admit that we're not a military power, we really do still have a military. We're about 68,000 regular force or active duty people in uniform. That's across all services. In terms of warfighters, it's about 30,000 Army, 15,000 Air Force, and 10,000 Navy. There are another 27,000 in our reserves. We also think that our diversity can be an enabler in global operations in everything from having members with a shared language or heritage in the places we deploy, or in locations where communities are more defined along gender lines. At any given time, we have about 3,000 people overseas on missions. As a rule, these deployed personnel are part of combined missions with other nations. They might be doing a bilateral mission like our Op Carib with the US, doing drug interdiction in the Caribbean. It might be with NATO, like our enhanced force presence in Latvia as part of the alliance tripwire against Russia. Or they are traditional UN missions, like our one-person contingent monitoring the truce in Cyprus. The two recurring missions that have at least a little GH flavor would be our many Ops Renaissance for humanitarian assistance and disaster relief, and our Ops Globe, like those aboard the Comfort and the Mercy. The point is, none of these missions are Canadian forces going out completely on our own. They are all contributions to a combined campaign. This is what one of our former chiefs of defense staff invented the term contribution warfare. What this also means is that the vast majority of our people are actually home in Canada, as you would expect given our three-part strategic policy to be strong at home, secure in North America, and engaged in the world. So strong at home, ready to defend ourselves against any threat or hazard, which lately has been natural hazards and disasters like floods and wildfires. Secure in North America, doing our part to defend the airspace as part of NORAD, and our waters, especially in the Arctic. And engage in the world as part of our whole of government foreign policy of convening. With other nations, we were deployed quickly to Afghanistan just recently to evacuate selected Afghans to Canada after the Taliban took over. And in Ukraine, we had a mission which focused on the development of senior non-commissioned members and junior officers as the armed forces of Ukraine continued their shift away from the Soviet era of central leadership doctrine. We, of course, had to pull out as the Russian invasion started, but we like to think that we had at least a small part in what we're seeing now with nimble and effective Ukrainian command and control led by senior NCMs and junior officers standing and retaking ground against Russian forces who have their top-heavy leadership. Canadian defense policy calls for 8 core missions you see here. As you can see, everything abroad is in the context of a coalition, whether with NATO, the UN, or other partners. Canada is never alone. We don't campaign. Our model is rather a contribution warfare. There is also a core mission entirely focused on capacity building. In the middle there, to engage in capacity building to support the security of other nations and their ability to contribute to security abroad. There's some self-interest, of course, in that stable countries are the one we want to trade with, but also that it reduces the need for our own kinetic engagement and the risk of casualties. So to that end, there is an entire section on defense diplomacy and engagement. But like foreign policy, it's so broad and flexible that anything can be made to fit. This can be both a help and a hindrance. There's freedom to maneuver to those with vision and funding. If you're a mission leader, you have some flexibility to create and adapt initiatives under your own authority, but it doesn't generate an enduring mandate or sustainable planning and support. The main thing it ends up doing is driving towards, interoperability and cooperation. It also means we have really no skin in the game. We have very little international military permanent presence where military GHE would be of benefit. And because we don't have much of a permanent presence, the military is not set up to look at long-term issues like global health, which really needs a strategic long-term outlook, like looking at outcome changes in health measures. rather than the metrics that we often focus on in the military, which are more short-term, like patients seen during the course of a mission. But I guess when you're starting from scratch, there's only room to grow. There's been increased attention to the military medical service generally over the years here. Our successes in Afghanistan, we led the multinational Role 3 in Kandahar from 2006 to 2009. And we were also the largest contributor of medical personnel after the US. So that helped raise our profile within the military and the public at large. That said, it's still a work in progress in our military culture. We're generally not used to medical being the mission and medical leading things rather than being the supporters. Moreover, the perception of the CAF Health Services is much of what's captured here in these standard briefing photos that we use in our public relations products, that our mission in military medicine is pretty much exclusively clinical care. And that's just not in the military community, but the perception within the medical branch often as well. As an example, here's the doctrine guiding our roles in GHE and the training we get. This is intentionally facetious. It really is in development, and it is expanding quickly with support for the GHE certificate program, of course, at USIS. I do believe that thanks to USIS and Colonel Bodig and all of you here who are working with the Canadians on this course, we are building our own pool of GHE practitioners that will build our own capacity. Right now, humanitarian assistance and disaster relief is the primary focus of any activities we do that could be brought under the GHE umbrella. These pictures are from our Op Renaissance response to Typhoon Haiyan in the Philippines in 2013. There's also been similar responses with our disaster assistance response team to Nepal, Haiti, Sri Lanka, Turkey, and many of the same places that your countries have also gone to. These are all time-limited missions, about a month, and would include the key elements like logistics and engineering repair to infrastructure, water supply. But also, like many of you, getting medical people out to do checkups and outreaches. We're part of the recurring cast on the USNS Comfort and Mercy. We often send our dentists, nurses, medics, lab techs, and imaging techs. And this has been great for interoperability and training for us with the US. But as you've already discussed in this course, the long-term developmental intent as a GHE in these sorts of missions is a bit soft. Op Sorona for Ebola and Sierra Leone was our first CAF operation where medical was actually in the lead, though it is, of course, another example of contribution warfare where we didn't go in on our own, but instead joined with the UK contingent in Carytown. We even outsourced our medal to the UK as we didn't issue our own. So to our British friends there, thanks for sharing. Perhaps the closest we get to any true GHE in the military is in our capacity building efforts. Again, medical hasn't been in the lead for these, but they are rather part of a broader military to military engagement. I mentioned the one we had in Ukraine, which did include some medical training. The mission that I had the opportunity to be part of was during our time in Afghanistan. In Mazar-i-Sharif in the north of the country, we were part of the NATO training mission to advise and mentor the ANA Medical Corps. And this was a shift from years of assisting the ANA, and rather than providing embedded services, we were attempting to provide some basic frameworks for medical practice and self-regulation and self-evaluation, building towards standards for primary emergency and surgical care and having sustainable clinical systems. So even if ACLS and ATLS as we know it might not work there, then at least something like it that is reliable and repeatable in context that would improve outcomes. Unfortunately, as is often the case, Western forces likely drove the focus and the expectation on getting equipment and material. And because we all knew this was time limited, it was hard to truly commit to sustainable change and mechanisms to assure accountability and enduring effort. But there was at least a clear short-term gain for both sides to keep the favor tilted towards NATO, to support the Afghan government and the ANA. Our other challenge is that even once we do have doctrine and a cadre of GHE practitioners, our capacity to dedicate military medical services to GHE is fairly limited. The pandemic in particular reminded us how limited our resources are, at least personnel-wise. We do, of course, have some niche capabilities like transport of persons with highly contagious infectious diseases. So it does mean that our focus in the military is much like the general trend in foreign assistance generally towards targeted, short-term, immediate emergency assistance or relief, rather than enduring development and capacity building. I'll speak a bit about the CAF and how we might have a role with development of Indigenous communities in Canada, since Colonel Professor Bijleveld spoke about that on the Aussie module a few weeks ago. As you heard from Australian friends, they have a well-established Army Aboriginal Community Assistance Program where the Australian Army works with various projects, typically including construction, health, and civilian training. Similar programs have actually been suggested in Canada, but it's really not part of our mandate here. Similar to Australia, we are a country that is going through a reckoning and reconciliation process with our First Nations peoples, but direct development aid through the armed forces, at least, isn't really part of that. There is some military activity that could be considered developmental assistance or humanitarian aid to Indigenous nations in Canada, but the underlying intent is clearly part of our military mandate. For example, any construction activity done by our engineers in a First Nation community would be clearly part of training as the primary objective. And of course, emergency assistance like evacuations or medical support is the same that would be on offer to any Canadian community that declares a disaster. Rather, our engagement with Indigenous people has been to empower them having a role in the armed forces. In the Arctic and the North, for example, the Rangers are the frontline presence of the Canadian military. We're also empowering Indigenous people to maintain their cultural traditions and support their integration to the regular force. So tying back to strategic interest, like good Canadians, being nice, wanting to be liked, even if our resources are limited, what we do in the Canadian Forces speaks to supporting global stability, sustaining the multilateralism and collective defense, and the rules-based international order. And it also addresses that fundamental Canadian existential angst about our identity, our desire to exert a positive influence on the national stage. For convenience, here's a slide with some bottom line key points we just discussed, and it reminds me to credit again Lieutenant Colonel Carlo Rossi and Lieutenant Commander Ernie Ebert, as well as some discussions with Major Jennifer Drew, who contributed some thought to these points. So I hope this gave you a bit of background to consider some questions like these, and perhaps many others that we can chat about in the forum or on the live session. Thanks for watching. I hope my accent was fairly clear to most of you, and I'm looking forward to our discussions. Talk to you soon. Cheers.